As we approach World AIDS Day next week, these statistics are an eye-opener. There are 1.2 million people living with HIV in the United States, and 1 in 5 are not aware that they have it. Every 9.5 minutes, someone is infected with HIV, and even though African Americans make up about 13.5% of the population, they account for about 52% of new cases in HIV/AIDS. With that as a backdrop, welcome back to Houston Newsmakers, where I'm joined by Kelly Young, the CEO of AIDS Foundation Houston. Good morning. Thank you for being here.
Thank you for having me. I'm just thrilled that you were even willing to bring up this conversation.
Oh, absolutely. We're coming into this week where we're talking about your big lunch, the World AIDS Day focus on that. And you saw Dr. Barnes talking about all of these things earlier, and you focus on this all year round as well. When you hear those statistics, you see them all the time. What does it do to you as an organization as you are motivated to try to bring awareness about what you need to do?
For me, it really drives me forward because we are on the precipice of being able to get to zero if we would just follow through on the commitments that were made 30 years ago. And so in my mind, it's like this is the time for us all to step up and show that City of Houston could be the first city across the South that ends HIV transmissions in the United States.
You are really an eternal optimist, aren't you? I mean, when you say you're on the precipice,
yes, yes, there is no reason, there's no reason we should not be able to get to zero. In fact, my whole goal is to work myself out of this job, the job that I have, and hopefully somebody will hire me doing something else later on. But no, there's no reason for us to have that many transmissions.
When you said we just need to do something that we started 30 years ago, such as?
Well, 30 years ago, there was a very clear message by the community, and the speaker who's coming to our luncheon was a part of that said, we need to tackle this as a public health issue. And if we take it from a public health standpoint, there are medical interventions, preventions, and interventions that can basically end the transmission of the disease, which means then you have no new infections. And, and what you do to do that is everybody gets tested. Once you get tested, you know your status, stay in care. And then if you are not, and you are engaging in behaviors that might create a risk in the public health part, then you get on PrEP, which was talked about by Dr. Barnes. And that will just basically allow for the virus not to be able to find anybody to attach to, and it goes away.
Once upon a time, when you found out, or someone found out they had HIV/AIDS, it was a death sentence. So at least they thought it was.
Yes.
Obviously, medical research has turned so that it may not necessarily be the case anymore. How has medical science evolved, and what role does it play now in terms of lifespan of those who do have HIV/AIDS?
Well, interesting. They've actually done a study that showed that individuals who are HIV positive have better health outcomes in the long run because they are actually engaged in health care more readily and steadily throughout their life. So before, where it was that the virus took over your body and then you had more infectious diseases that came on, and that's what caused you to go into what was considered AIDS, and you were fighting all of those diseases, now basically the medication keeps that load of viral, that virus load so low in your body that it cannot create all those infections. So it's basically just suppressing the virus to a point where it's almost like you don't have it. Some people are actually undetectable once they get into medical care.
What do you do at AIDS Foundation Houston? What's the mission of your organization? And you've already said you want to be out of business.
I do. I mean, and I believe that the founders of the organization basically were not expecting us to be in perpetuity. I think they believed we were going to solve the crisis, move forward, figure out the answer, and we have. So what we do is really make sure that those that are most vulnerable, those that might have more complicating issues in their lives that are also HIV positive or have the potential of becoming HIV positive, get the types of services they may need. And that may include housing, that may include additional food support. The education side is to go to the neighborhoods that are not having these conversations and plopping down with our mobile testing unit and saying, no, come get tested, we can help you. And so it's more about looking at the social aspect and ensuring that the justice is there for those individuals who might be finding stigma, having their family be a little resistant, you know, and helping them figure out how to manage that.
Talk about your lunch. Who's going to be there? You kind of just touched on just a little bit of one of the guest speakers.
And this is, we have a lot of luncheons in Houston. I'm sure you know that because you've emceed at least 12,000, I'm pretty sure.
Close.
Right? This is a very important luncheon because it's a recognition every year of honoring those that we lost to AIDS and to remember that we have a future to end HIV in our community. So our luncheon is on December 1st, which is World AIDS Day. I would like it to become the luncheon that says World Without AIDS Day. That would be my preference for the luncheon. But we have Sean Strub, who was one of the founders, one of the original members of ACT UP, who did most of the activist work at the beginning to get legislation changed around how we dealt with medications and HIV. Then he ran Pause magazine, which really talked about a positive life and people who are HIV positive living a positive life. And now he is over the Zero project, which is talking about the criminalization of HIV. Gotcha. So this is an individual who at very different points in times has moved in the direction of helping end HIV throughout his career. I'm very excited about him. And then secondly, we have Dr. Grattoni, who is, and this is a perfect fit because Sean Strub was at the beginning. This is where we are now. Nanomedicine at Methodist basically has come up with an implant that can go in your arm and give you your medication for an entire year.
Amazing.
So we've removed that barrier.
And so you're honoring him?
And he's getting honored by the Shelby Hobbs.
That is fabulous. I want to make sure everybody knows this Thursday, December 1st at 11 a.m. at the Hilton Post Oak. Website is aidshelp.org.
Correct.
Get all the information. Still tables available.
Yes, come on out. It's going to be a great luncheon.
Kelly, good to see you.
Thank you.
All right, get out if you can. It's going to be great. We're going to talk now about something that you may not have heard about. It's an alternative radio. We're talking about InGen. What does it mean? Why should you tune in? We'll talk about it right after this.